Kidney protection from Ozempic, Semaglutide, is real, but it applies to a narrower group than many headlines suggest. The strongest evidence is for adults with type 2 diabetes and chronic kidney disease. It is not proven protection for every weight loss user. If your kidneys are normal, this headline can give the wrong reassurance. That difference changes the whole decision. That distinction matters because kidney disease often develops without obvious symptoms. A protective drug can sound powerful when the risk feels invisible, but the protection was shown in people who already had measurable kidney risk. One early reason is better blood sugar control, which can reduce stress on the kidney's tiny filters. The key issue is not whether Ozempic is good or bad for kidneys. The key issue is whether your diagnoses and lab results match the group that was studied. A headline may say kidney protection, but your lab results decide whether that phrase applies to you. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Ozempic helps the body release insulin after meals. Insulin is the hormone that moves sugar from blood into cells. It also lowers glucagon, another hormone that tells the liver to release sugar. Together, those effects can lower blood sugar exposure over time. Ozempic also slows how fast your stomach empties. That means food moves from the stomach into the intestine more slowly. After meals, sugar enters the bloodstream at a slower pace. For the kidney, fewer blood sugar spikes may mean less repeated stress. But this was not a general prevention study. The kidney outcome trial followed adults with type 2 diabetes and chronic kidney disease. Chronic kidney disease means kidney damage or reduced filtering that lasts over time. These patients were already at risk for serious kidney decline. The trial compared once-weekly Ozempic with placebo. Placebo means an inactive treatment used for comparison. Most patients were already receiving standard kidney care. That can include kidney protective blood pressure medicines, which lower pressure inside the kidney filters. Ozempic was tested as an added layer, not as a standalone kidney plan. The main outcome combined several serious events. It included a major drop in kidney filtering, kidney failure treatment, kidney death, or death related to heart disease. Kidney filtering means how much blood the kidneys clean each minute. Ozempic reduced that combined risk in the studied group. The study did not count tiny lab movements as the whole story. It looked at serious real-world outcomes, like major filtering loss and kidney failure treatment. That makes the result meaningful for real patients. It also makes the boundary clearer, because the result belongs to the risk group that entered the study. So the kidney benefit is real, but it is not a universal promise. The result belongs to the risk group in the study. Even for that risk group, safety still matters. A protective drug can still cause trouble in the wrong situation. Can a kidney protective drug ever stress the kidneys? Yes, in the wrong situation. Severe nausea, vomiting, diarrhea, or poor fluid intake can cause dehydration. Dehydration means too little fluid in circulation. In vulnerable patients, that can temporarily worsen kidney function. Kidney protection does not mean kidney immunity. It does not mean you should ignore side effects, skip fluids, or push the dose faster. Older adults and people on water pills need extra caution. The protection story and the side effect story can both be true. One patient may gain long-term kidney protection. Another patient may become dehydrated during dose escalation. Dose escalation means moving from a lower dose to a higher dose. The same drug can produce different kidney situations. Another hidden issue is timing. A kidney benefit develops across long follow-up, not after one lucky injection. But dehydration can appear within days during nausea or poor intake. Long-term benefit and short-term dehydration risk happen on different timelines. People with advanced kidney disease need careful follow-up. Reduced kidney function does not automatically forbid Ozempic. But current illness, fluid intake, and other medicines can change safety quickly. A stomach virus can turn a stable situation into a riskier one. Call your doctor promptly if vomiting or diarrhea does not stop. Also call if you feel faint, cannot keep fluids down, or notice much less urination. These symptoms do not prove kidney injury. They mean kidney risk needs timely assessment. During an acute illness, the issue is no longer future kidney protection. The issue is whether fluid loss, low intake, or other medicines are stressing the kidneys today. That decision should be made with current symptoms and labs. After safety, the next question is whether the evidence fits you. The strongest kidney protection evidence fits a specific patient, an adult with type 2 diabetes and chronic kidney disease. Many patients in the studied group also had abnormal urine albumin. Albumin is a blood protein that should mostly stay out of urine. When albumin leaks into urine, it can signal kidney filter damage. This is why a urine test matters. A blood kidney number can look acceptable while urine albumin is already abnormal. For some patients, the urine result changes the whole risk category. Doctors often repeat abnormal urine results because one sample can be affected by exercise, infection, or dehydration. A repeated pattern is more useful than one surprising number. That is why one abnormal result is not enough to decide. Kidney filtering and urine albumin answer different questions. Filtering tells how much cleaning power remains today. Urine albumin tells whether the filters are leaking protein. One can look acceptable while the other raises concern. That is why both tests matter when someone hears a kidney protection claim. Your lab pattern matters more than the headline. Ask about your kidney filtering number and your urine albumin result. Ask whether your diabetes history matches the studied group. Ask whether your blood pressure treatment already protects the kidneys. Ask what result would change your plan. Now compare that with weight loss use, especially when type 2 diabetes is not present. Start with your kidney tests. If those tests are normal, the kidney protection claim is not proven for you in the same way. Family history or reduced response to insulin may justify screening, but those concerns are not the studied kidney population. Use a checklist instead of a slogan. First, confirm type 2 diabetes. Second, confirm chronic kidney disease through blood and urine testing. Third, check whether side effects are causing dehydration. Fourth, review other kidney medicines before assuming Ozempic is doing the whole job. That same checklist also affects insurance and clinic decisions. A kidney-related approval does not mean every patient qualifies. The record usually needs the right diagnosis and lab evidence. If those pieces are missing, the headline may not match the paperwork. For a patient with diabetes and kidney disease, Ozempic can be a serious discussion. For a patient with normal kidneys, it should not be sold as guaranteed kidney protection. The difference is whether the person started with real kidney risk, matched the study, and can be monitored safely. The bottom line is simple. Ozempic kidney protection is real, but it is not a universal shield. It applies most clearly to adults with type 2 diabetes, chronic kidney disease, and lab markers showing real kidney risk. Kidney protection is not a slogan, it is a patient profile. Use the headline to ask better questions. Medicine, simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.